think the best thing that pharma can do is to not just educate the customer, not just sell to the customer, but to actually inspire the customer, to understand that the customer has not just professional desires and inspiration, but actually wants to have a career of their own and actually much bigger targets that they might have in their lives. I think that we need to make not just their lives easier, but their career easier, their trajectory easier. I think that we need to be aiming basically a little bit higher by actually having something aspirational for those physicians to actually work with.
I think we start with the customer experience and map the customer journey through their day-to-day life, just the same way we put that amount of effort into mapping the patient journey and understanding where we need to be and why and what value we add. And I think we have to partner with other people. I think if we keep trying to do everything ourselves, we'll always come up short and maybe even be biased in what we deliver. So I think if we look at a holistic, journey and what we're trying to produce as far as patient outcomes, I think that's where we can be a better partner to HCPs.
The most important part is to figure out what our customers really want and then solving that need. I think, again, we very often push things out that we need to push out rather than finding out what they want, what kind of issues we can solve for them. So in terms of customer experience, that should be the starting point, solving the issues, and then we can figure out all the channels and all of that around it afterwards.
I think one thing that we could do better at in providing customer experiences is truly just knowing our customers, understanding what is their workflow, what's valuable to them, what's not. In the past, again, we were able to strategically do push information, push things we want them to hear. But now I think we have the opportunity with the technologies and also the data to understand truly what's good for them, at the end of the day, what's best for their patients. So strategically, we can work more closer with our customers by knowing what they can provide and what they can do for us as well.
I think we really need to focus on, are we adding value to the customer? We need to be measuring if we're adding value or not to the customer. When we measure impact, it should be much more about pull rather the other way around than push. And so we should be looking much more on the pull side of things. And when we look at something like customer engagement scoring, so where you're trying to understand how your different channels are doing and the overall effect of your channel interactions with customers, what you're actually measuring in that engagement is that value that you're trying to add to the customer. And it's really a change in mindset. It's not just about the value the customer gives to us, it should be first about the value we give to them, and then how does that turn into value for us.
When I entered pharma 6-7 years ago, there was still a little bit of a buzz about closed-loop marketing as a concept. I think that getting the customer experience to that next level is really about getting the basics of closed-loop marketing right. So when we bring out something of relevance to our customers, that we learn from that and that we adapt to it in a very agile way. So we really need to get our mind and our organizations working with data in the right way so that it becomes actionable and so that we can actually fine-tune the customer experiences based on that.
I think be more customized to the specific need of our healthcare professionals. Although they work within the same therapeutic areas, they often have very specific needs depending on whether they're young or old, demography, etc. And I think the digital technologies enable a much more customized experience than we've had in the past.